CNA Written Exam 2025 Sheet 1. Question 1. While giving an unconscious patient a bath, it is important to give passive range of motion to all joints. Let the team leader exercise the patient's joints. Call the physical therapist to exercise the patient afterward. Exercise the patient only if the doctor has ordered it. Passive ROM should always be given with the bath on an unconscious patient. Question 2. A patient who is on suicide watch should be allowed to have a glass container of flowers in her room, a leather belt, a mirror, pictures of her family. An inventory of a patient's personal items, including clothing, should always be made on admission, and unsafe items should not be placed in the room. Question 3. A patient chokes while eating. The first thing the nursing assistant should do is ask the patient if she is choking, if so perform the Heimlich maneuver. Call for a licensed person. Slap the patient between the shoulder blades. Tilt the victim's head back and give 2 quick breaths. The Heimlich maneuver, also known as abdominal thrusts, is an emergency response technique that can save a life in seconds. Question 4. A patient who has been depressed and complaining of feeling hopeless suddenly appears happier one morning and says that everything is okay now. A good nurse aide congratulates the patient on getting better. Watches the patient more closely. Voids concern to the rest of the staff. B and C. A good nurse aide watches more closely and voices concern to the rest of the staff. Question 5. The circulatory system consists of heart, arteries, veins, and capillaries. Blood vessels, arteries, veins, and capillaries. Heart, aorta, pulmonary vessels, and lungs. Blood vessels, lymph nodes, and spleen. The heart, arteries, veins, and capillaries. Question 6. It is important that dressings remain tight to keep out bacteria, loose to admit air, clean and dry, untouched until ordered removed. Clean and dry. If the dressing becomes soiled or saturated, notify the nurse. Question 7. Drainage bags from urinary catheters should be kept below the level of the bladder. Have clear urine without sediment. Have their output measured. All of the above. All of the answers are correct. Always keep the urinary drainage bag below the level of the bladder to prevent urine from flowing back into the bladder. Question 8. A patient tells a nurse's aide that the foods on her tray conflict with her religious beliefs. The nurse's assistant should tell the patient that it is all that is available. Leave the tray there in case she changes her mind. Check the patient's religious preference on the chart. Take the tray away and notify the charge nurse. Take the tray away and notify the charge nurse. Question 9. A nurse's aide notices blood in a patient's 4 tubing. The aide should notify the nurse. Do nothing, that's normal. Try to flush the tubing. Stop the 4. Notify the nurse. Question 10. A patient calls the nurse's assistant and says someone spilled water onto my bed. The nurse's aide observes a moist area around the patient's perineum. The nurse's aide should tell the patient that she has obviously had an accident. Tell the patient to ask for a bedpan when she needs one. Change the linens and make a mental note to offer the bedpan more often. Ask the doctor for an order for a catheter. Clean the patient, change the linens, and offer the bedpan more often. Assisting the resident to use the bedpan every 2 hours helps decrease accidents, which is also referred to as bladder training. Question 11. In report, the nurse's aide is told that one of her patients has been ordered NPO after midnight. The aide should take away the water pitcher at midnight. Offer frequent snacks. Note all water the patient drinks and all output. Ask the patient if he is having any pain. Take away the water pitcher at midnight. NPO means nothing by mouth, and this is a term used to identify patients who should not receive fluid or solids by mouth. Question 12. A patient is leaving the hospital. The family has been told to change her dressings bid. The wife asks, "What does that mean?" The nurse's aide tells her to change the dressings. Twice a day. 3 times a day. Once a day. The only one needed. BID is a medical abbreviation meaning twice a day. Question 13. While taking a rectal temperature, the nurse's aide should insert the thermometer and go on his break. Hold on to the thermometer until it can be removed. Take care of other patients and return in 3 minutes. Stay in the room until it is time to read the temperature. Hold on to the thermometer until it can be removed. Care must be practiced when taking someone's temperature rectally. Question 14. Before performing any procedure, the nurse's aide must identify the patient. Wash your hands. Explain the procedure. All of the above. Identifying patients ensures they receive the correct treatment, hand washing reduces the spread of germs, and explaining the procedure allows the patient time to ask questions. Question 15. A patient has a diagnosis of psoriasis. Her nurse's aide should avoid contact with the highly contagious lesions. Wear gloves for patient care. Treat her the same as any other patient with a non-infectious disease. Wear a mask when entering the room. Psoriasis is not contagious. Question 16. Which of the following will not put undue strain on the back? Crossing one's legs. Lifting with the knees. Slouching. Twisting the back while moving patients. Lifting with the knees. Body mechanics help prevent back strain. Question 17. Which of the following is not true of blindness? Legally blind or visually impaired people have no sight at all. Diabetes is a cause of blindness. Always identify yourself before touching a blind person. Ask if a blind person needs help before giving assistance. Most legally blind people have some vision. Question 18. Which of the following is not true of dementia? People with dementia act uncooperative to be spiteful. They can have hallucinations. People with dementia are often frightened and anxious. Grooming is difficult for patients with dementia. Aggressive behavior may stem from fear, embarrassment, or cognitive loss. Question 19. Which of the following is associated with smoking? Pneumonia. Heart attacks. Vitamin C deficiency. All of the above. Smoking causes various serious health issues. Question 20. Most of our calories should come from protein, fats, carbohydrates, vitamins. Carbohydrates are a primary source of energy. Question 21. Blood-borne infections include hepatitis B and pneumonia, shingles, urinary tract infection. Blood-borne pathogens are viruses and bacteria that can be transmitted via blood. Question 22. Diabetes is common, often associated with obesity and a sedentary lifestyle, controllable, all of the above. Lifestyle changes can reduce the risk of diabetes. Question 23. Goals of arthritis care include preventing contractures, decreasing inflammation and preserving joints, strengthening bones and muscles, all of the above. Goals include improving mobility, strength, and joint preservation. Question 24. Which will not prevent pressure sores? Repositioning or turning the patient every 2 hours. Applying lotion to dry skin. Keeping bed linens clean, dry, and free of wrinkles. Scrubbing and rubbing the skin vigorously. Scrubbing and rubbing the skin vigorously. Question 25. Why should heat not be applied to a diabetic resident's feet? The feet have more oil glands. Diabetics have decreased sensitivity, which means they cannot feel the heat and could cause a burn. Their feet are dirty. It makes their feet wrinkle. Diabetics have decreased sensitivity, which means they cannot feel the heat and could cause a burn.